here the other question that many people ask me sometimes is, but is it a real emergency all the time? And most of the time, yes, because as you know, most of our animals are not telling us when they are in pain, discomfort, if there is something that is not right. My dog, that few of you knows, Nero, when there is a problem, oh, he's a princess. He's start to moaning or limping if there is just a tiny stone in between his paws, or if it's like if he has any discomfort in his belly, he show me. So he looks like that he's a little bit more of color, he's a little bit poorer, or he's coming to me to tell me, please help me. I know that say that from a vet sounds weird, but I can tell you, yes, it's true. And when you are telling me, oh yes, my animal is telling me that it's not right, I can believe you, because it's most of the time it's like this, okay? Because we know our animals and we know when they're not well. So when Nero has something that is not right, I probably know, and I can start to investigate and see under the paws or feel his belly. But in the exotic case, most of the time, this is the situation. I guess that you already saw this meme, but it's very true. So every time you see something that doesn't look normal, don't ignore it, okay? Because again, a few minutes attention to your animal can make a massive difference. But what we can do in this case, so, okay, he's sick, and now what I can do? But could be very helpful to have like a list of exotic vets close to you. And on the RCVS website, there is the page, Find a Vet. It's not specified most of the time if it's a rabbit or not, but could be anyway helpful and to check on it. Or there is the RWF vet list, where there are specific vets for more specific vet for exotics. I cannot use the word specialized because not all of us can use the word specialized. I'm not a specialist, for example, but I'm working with them all the time. I have several qualifications, several certificates, okay? So also if an exotic vet is not specialist, doesn't mean that he's not able to deal with them, okay? Let me admit there is another person that's joined us now. But on the Welfare Association Foundation, you can find the list of all the rabbit/exotic vets. There are other few pages that you can obviously check to see which is the vet closer to you. There is also the page of the BVSDS, that is the British Zoological Veterinary Society, where there is also the chance to ask where is the closest vet. And you can have this list there if you already don't have already an exotic vet. But remember that any vet can help in case of emergency. So if your exotic vet is, say, 50 miles away from you, and there is another vet that is literally round the corner, he must anyway be able to assist, at least to stabilize your animal and put him in the best condition to go to the exotic vet. And what you should say, because perfect, you have your rabbit, your parrot, your tortoise. There is a situation that, as we saw, the claw that is bleeding or anything else that doesn't look properly right. We grab the phone and you have your vet calling him, and what you should have to say to him when they answer. First of all, the species. And if there are any previous sign, episode of the problem that you are referring, or anything that apparently looks unrelated. If the breathing is faster or the mouth is open. if he's starving, and since when? Few hours, few days, few weeks. Bear in mind that hours, days, weeks are specific, means that is few hours could be quite a lot for a rabbit, but they could be normal for a tortoise because the tortoises are not eating every day. Sorry, not are eating every day, but not constantly like a rabbit. A snake is not eating every day, so few days of starving are completely normal. They start to be concerning if they start to be several weeks. If the feces, back to the smaller feces, if the feces are smaller, since when? Few hours, days, weeks? Again, if it's a rabbit guinea pigs, you shouldn't wait too many hours. If it's because they are producing feces literally all the time, a massive amount, or a leopard gecko that you cannot see every day if the feces are bigger or smaller. So it's something that you can see in obviously few days apart. And in case there is any lesion, which type of lesion? If it's a fracture, if there is an active bleeding, is an infected wound. And now try to see this one by one, and for each, what we can do. For example, smaller feces. They start to be, as I said, an emergency or something that need to be seen as soon as possible if they start to be smaller for more than 8-12 hours. See, this was the picture that I was telling you before. You can see the feces were what's bigger and then smaller and smaller. So what you can do, call your vet, you can put your rabbit, your guinea pig. The other feces here are a chinchilla. I saw before when I asked which animal you have, there is someone with chinchillas. And what you can do, you can, if you don't see any other signs of pain, discomfort, you can try to offer a different food and see if they're eating. In the meantime that, for example, you don't have an appointment before 4 o'clock this afternoon and it's still early morning, you can start to offer something different. You can, if you have some critical care or some syringe feeding, you can try to offer just a small amount. You don't need to stuff your animal with something that can cause much more problems. Avoid to use medication. At least your vet, you are telling over the phone, yes, you can give this, this, and this. Don't choose by yourself any medication or anything else, because at that point it could be worse. And then, as soon as possible, go to the vet. You can bring also a sample, because sometimes, or take a picture like this, because you can show to the vet which was your concern, showing also what was normal for your rabbit and what is at the time that you start to see that they start to be smaller. Opening wounds. This, as I said, is something that's required to be seen as soon as possible. This is literally a proper emergency. So this was a rabbit that fallen from the arm of the owner and smashed his nose. And what you can do in this case, when there is an active bleeding, again, from the vet, say that you are going there as soon as possible, depending on also his availability, or go again to your closer vet. And the first and most important things that you need to do is to try to keep the airways clean, because the rabbits, like guinea pigs or chinchillas, are breathing mainly for the 98% from the nostril. So if the blood starts to be clotted on the nostril, they are not able to breathe, and they can start to breathe with the mouth. So first thing of all is to try to clean the nostril. You can use a cloth with a little bit of warm water, but keep clean and then go to the vet. Because if you're putting your rabbit with all the blood on the nostril, the journey could be very dangerous, because at some point you need to drive, so you cannot check on your rabbit soon. So you need to clean first and then go straight with eye trauma. This is something that happened very often. I had with guinea pigs. I had a guinea pig that she had the very bad habit to put her head under the hay. And once the eye has been damaged by a piece of hay. So, and she has been quite unlucky, but in most of the case, thankfully, it's not so dramatic situation, but a wound on the eye is something that, again, need to be seen as soon as possible, because this can affect the rest of the eye. And in this picture, you can see what we can do once you arrive to the practice with the fluorescing. That is literally we can stain the eye with the fluorescing, and the lesion on the eye can react to the light and become very green, yellowish, fluo green, reacting to the light. And this highlight where the lesion is. In this case, was an abrasion, so like a scratch on the eye. But also if it was still just superficial, was good to see this rabbit soon, because allowed to start a treatment with like local eye drops, protecting the eye, to avoid that this can become even worse. Again, if you need to clean the eye, you can try with a little bit of warm water, a wipe. Don't rub on the eye, but you can clean all around the eye. That could be anyway helpful. Increase the respiratory effort, like with mouth open. Really, in this is quite a dramatic situation, because a rabbit that is breathing with the mouth open, and you can see also that was struggling quite a lot with the nostril. This should be a situation that you shouldn't waste a single second, okay? What you can do to help your rabbit within the carrier, try to stress less as possible, because this can cause obviously an increase of the respiratory rate, and put him again in the carrier, like with few more towels, to avoid that during the journey can roll or lose the balance, because in this situation the rabbit is completely focused to try to breathe, so he can panic very easily and he can lose also his balance. Don't try to feed the rabbit in this situation, because it could be quite counterproductive, because he's literally struggling already to breathe. So don't try to put anything in the mouth. If you see that there is any discharge, again, that can probably cause the increase of the respiratory effort. You need to clean and wipe the nostril, but again, don't waste any seconds. Blood in the urine, called hematuria. We mentioned in the stable list the cloudy urine. Perfect, something that can wait. If you see blood in the urine, this case is something that cannot wait, because it means that potentially there is an infection, that there is something that caused the bleeding, like a stone in the bladder, in the less worst case scenario, or something that is obstructing the urethra. And in this case is the worst case scenario that could happen. So if you see blood, again, in this case, you can, again, wipe and see if there are any other problems, but bring to the vet as soon as possible. Sometimes the urine in guinea pigs and rabbits can be quite red, okay? And they can confused with blood. I had on my email several pictures, a collection of pictures of red urine, because obviously some of you can panic, send a picture, oh, it's blood. Or I can see sometimes also in some Facebook group that people, oh, can you tell me please what is? From a picture is very difficult, okay? So if you think that is unusual and you think that is blood, again, don't post the picture on Facebook or ask to someone else, or just bring to the vet. Because if it's a stone in the urinary bladder, this is a proper emergency. Think it's something that probably I'm not advised to no one, but for for human beings, the urinary stones are one of the most painful conditions that we can face. So think a tiny creature that's with a stone that could be also a few millimeters, but compared to the body size could be massive. The pain and the discomfort that can feel. So also in this case, unfortunately, there isn't too much that you can do, if not just bring to the vet as soon as possible. Fracture or a trauma. This was a young rabbit where the owner stepped accidentally, wasn't voluntary, on the front leg. And in this case, for example, what you can do about bring to the vet is try to stabilize the fracture. You can gently or put the rabbit in a position that is not moving, okay, like in the carrier. You can try to stabilize in the sense that avoid that the rabbit can do any unnecessary movement. Don't try to like cast the leg, because it could be even worse, okay? But put the rabbit in a position that is not moving at all, or if you're two and there is someone else that can help you to go to the vet, you can obviously wrap your rabbit in a towel, like bunny burritos, rabbit burritos, and avoid that he can move too much. Because in this situation, the fracture was closed, means there wasn't any communication with outside, so there wasn't an open wound that can increase massively the chances to avoid infection and potentially save the leg. But this is something that just the vet will be able to tell you after we took up an X-ray like this. A tilt, acute head tilt. Again, we are back to E. coli, or there is another condition that can cause the same signs of the head tilt, that is called vestibular syndrome. Vestibular syndrome is syndrome, so a group of problems, disease, that can affect the ears. And because in the ear there is the center of balance, if these are affected, obviously they can start to twist the head, rolling. And in this case, the first things to do is to avoid that your rabbit can roll too much, self-traumatize. So again, the carrier with a lot of towels to hold him could be the safest things. You can check if he's eating or not, drinking or not. You need also to check the eye, especially the one that is underneath, because sometimes this could be in contact with the hay or with the litter, the substrate. So, or is the one that can be first traumatized with the impact with the floor. So what you can do is hold your rabbit, put in a situation where he's stable and is not able to rolling and traumatizing more. And don't be tempted also in this case to give any medication. First, because potentially could be the wrong dose, okay, or potentially is not the dose that he needs, especially with the E. coli. The treatment that usually we can use at the practice is called embendazole. This is the drug that we use against the E. coli. But if it's used when it's not needed, it can has any medication some side effects. So it's better to leave the decision to your vet. At least your rabbit was already under a treatment, and you're just continue this treatment. Then we have, there probably doesn't exist, also with your best efforts, doesn't exist a house that is bunny proof. Okay, so they can still try to heat wallpaper, skirting boards, or electric cable, electric wire. So the risk of a burn, electrocution, poisoning are literally, with this animal, literally around the corner. And as I said, you need to stabilize, do what I told you, but then go to the nearest vet. And then there is, I know that everyone was waiting for this. When a guinea pig or rabbit are bloated, not eating, and also the abdomen is bloated, this makes the difference between a rabbit that is not eating for a few hours and a rabbit that is not eating at all with the bloated abdomen. This is what could be mean. I know that's you're thinking about that, and that is the so-called gut stasis. Welcome to the gut stasis. So what is gut stasis? And especially in rabbits. So it's a syndrome. And again, with syndrome, we mean a lot of different things that can make this situation visible, okay? And essentially is anything that can affect the gastrointestinal tract, because stasis is when the gastrointestinal tract starts to working less, moving less, or stopping completely. What can cause this stasis? This is a short list of some of the causes that can cause stasis and some of the signs. So we can go through very, very briefly, but ileus is a proper gastrointestinal problem when there is a lack of motility. When a rabbit is grooming himself, or especially when they are living together, they're grooming each other and they're swallowing a lot of air, far. And this can cause like a furball in the stomach. And as you know, rabbits are not able to vomit, so it will stay there, okay? And at some point can cause the stasis. Foreign body, liver lobe torsion is the one that is a little bit more tricky to identify, but is another problem that can cause the stasis, because it's a very painful situation. So the rabbit is in very pain and obviously is not thinking about to eat or do anything else. Intussusceptum is a condition where we have a part of the intestine is going into the following part, so causing like a restriction, a stenosis, a restriction of the gas, the lumen, the space that there is in the intestine. Volvulus, torsion, so anything that, again, can affect the intestine. Anything that can grow in the abdomen, like mass, abscess, or neoplasia. Rabbits that are not spayed, are not neutered, sometimes they can develop, most of the time, with the age, can develop this type of very big masses. And when the mass reach a point that is so big that there is any other space for any other organs, also the intestine can be affected. Then we have infection. E. coli is back with us. Also, the E. coli sometimes has been seen be related with the stasis. Parasites, especially in young rabbits, or when the load of parasites in the intestine is so high, they can damage the intestine and consequently cause gastrointestinal problems. Post-op surgery, stress, malocclusion, on dental pain, because the rabbit is not eating the right diet, the right amount of fiber, so this can make the intestine slower. Inappetence means that when the rabbit is not eating. Wrong diet. Again, there is still a lot of I don't want to say ignorance because it's not intentional, but lack of communication or information about what is the right diet for a rabbit or a guinea pig. I see many of you that in the different Facebook group, they're doing a very great job every time sharing diagram or advice on what a rabbit should eat. But again, there is still many rabbits, guinea pigs that are receiving the wrong diet. And the wrong diet can predispose to these kind of problems too. Plus dental, plus, because it's not the right one, but also can predispose to gastrointestinal problems. Inflammation, because if the intestine is inflamed for any other reason, it's not working well. Age, elderly rabbits are more prone, like we can be more prone to disease. Also, the elderly rabbits can be more prone to gastrointestinal problems. Arthritis, the arthritis is painful. So again, because the stasis can be related with pain, discomfort, also this could be one of the causes at the base of the stasis, and any other sort of pain, discomfort. And what happens? So which is the next step? Giving only the medication is not fixing the problem, because again, we cannot, if we want to fix a stasis, we should give and treat all this disease all in one go. Okay. Or we need to decide, okay, I can give this or that, or but there is also this or the other medication, a painkiller versus a prokinetic, or something different, or the fenbendazole for the E. coli. It's literally like flipping a coin. So you need to, with a lot of different phases. So it's more a dice than a coin. And sometimes you can guess the right one. Oh yeah, see, now it's pooping again. It's fine, I fix it. Or sometimes you don't. So in any case, you suspect that your rabbit has gastrointestinal problems, you need to refer your vet. And what happens? So which is the next step? So you arrive to the practice, okay, and what the vet can do, okay, after he's doing his physical examination, he can put, obviously he needs to know what he's looking for, okay. For that I say an exotic vet usually is more in use to, oh yeah, now I can feel the abdomen. He knows all the possible causes that can be associated with the gastrointestinal stasis, but he needs some help to understand what is going on. Because most of the time, asymptomatic treatment could be enough. Oh yeah, no, I can feel the abdomen is fine. I can see that mucosas, the heart rate, the chest, everything is fine. So you can decide, oh, in this case, for your rabbit, the symptomatic treatment is enough. Or sometimes, or most of the time, investigation to identify the causes are needed, like an ultrasound or radiography. With the ultrasound, we can check the abdomen, see if there is motility or not, try to investigate if there is anything wrong. With the ultrasound, we can detect if there is a liver lobe torsion. Most of the time, we can see if there is a foreign body, depending on the nature of the foreign body. But again, there are tools that can at least reduce the least of these problems, or a radiography. For example, in these two, you can see on the bottom is a rabbit, on the right-hand side is a guinea pig, and you can see how much air and gas there is in the gastrointestinal tract. These two were two patients that were quite in pain, in discomfort. So wait too long before go to the vet, especially if their abdomen weight is quite tense, could be quite detrimental for themselves, plus be quite painful. I know that I dedicated like literally just 5 minutes to this, but probably we can stay here for hours. So, but yeah, just the most important insight from this slide should be, don't panic every time that your rabbit is not eating, okay? Try to know your rabbit, your guinea pig, and try to feel it, or the abdomen is tense or not, and then call your vet and ask some advice. And be prepared that he will ask you to perform investigation, because we are not able just with our hands to feel everything. We studied a lot, and we have a lot of experience, most of us. But again, after 14 years that I'm working just with my hands, I'm not able to tell you, oh yes, I can feel this, or yes, could be that. I need something to help myself, and it's like a puzzle, and you need all the different pieces to put all together to have the complete picture.